Hi, everyone. So just to ask you guys a question, I mean, how many of you now have devices that you use to view news and magazines on your smart devices? Do many of you do that nowadays? Yeah? Or do some of you still prefer to pick up textbooks and papers and all that? That's still one, okay. So there's this transition, right, where everyone is moving towards this technological era, and we're trying to get everyone to go paperless, so that it's more green and everything will be more up to date. So I just want to share with you our story on how we got there, and start out first by, let me see. Okay, thanks. So I'll just start out by telling you a little bit about Biogen, and then talk about our old process of how we got from old paper, and then how we tried out the system, and then we got the implementation plan together, and then we were able to have the device, and as well as some ongoing enhancements that we're working with our IT group. And then finally, there'll be some demonstration to show you how we do it, and you get a better feel of how it's being done on the floor in manufacturing. So basically, Biogen is founded in 1978. It's private, it's an independent biotech company, and we're listed in the NASDAQ as BIIB. It's doing really well company-wise. We have 5 major products that's out in the market. We have Tefidera, which is one of the latest MS pills, and just recently being approved in Europe. We have our Avonex and Tysabri, Rituxan, and Fempra. So those are our blockbuster drugs that are out in the market right now. So basically, we have very strong strategy, to mainly focus on multiple sclerosis for patients and try to be a world-class leader in that area. And that's mainly the main focus of Biogen Idec in that regards. And this is sort of slightly outdated, but that's the only published financial data we have, that we're doing financially well and strong. And I was just looking at the stock price today. It's already jumping up to like $321. So when I started, it was only at $65. So great value. So also we have global footprint around North America, South America, Europe, Asia. And we have 3 manufacturing plants, one in Cambridge, one in RTP, and one in Hillerød, Denmark. One of the cool things we have over in Biogen at Cambridge is this Biogen Community Lab. It's really nice. What we do is we have high school students that comes in, and they participate in learning science from scientists at Biogen, and it gets them, a taste of what science would be like, and it's just kind of nice and fun thing to see how, they are able to experience that and to take that on with their career and their studies. So that's a cool thing that I really like. So now to move on to the real thing, that QUMAS compliance is what we've been using, and we use my QUMAS for some of the following features, such as procedures, SOP, master records, forms, technical reports, and other documents that are like graphical lotto. So those are like graphics to aid in locking out equipment for safety. So to tell you about the old method, it's going to sound really, really insane in what we're doing, right? So what we want to do is move from that insanity to something more efficient. So how we've been doing it in the past is that we get this notification from quality group. And the quality group would tell us, okay, these are your sets of procedures that you have to update at certain time that it's going to become effective. So we get this notification, and then we prepare this list onto an official GMP form so that we know these are what we're going to be performing for updating. Then once we have that, we make a copy of the pre-effective forms and documents, and we store that until the effective date. And why do we do it that way? Why do we print pre-effective? Because there are times when the documents become effective and you need to get that document and use it right away. We run into issues that printer doesn't work or the server will be down. So now things are effective, but you can't print your document or get your document. So to prevent that, we have those ability and access to pre-print the documents and have it ahead of the document being effective, but we have to control it to make sure that it doesn't get released for public use until it is effective, right? So we have all this stack of document that we have to put away. So now that it's effective, what happened is that someone from the manufacturing will come and approach us, and they will take the form and verify that everything from the quality group that tells us what they need to update is correct and accurate. Then from there, they make more copies because they know where they have to use these procedures or forms in more places. So they make more copies. And all this takes so much time. So I forgot to mention that just the notification part and the preparation part, that takes about an hour to go through the list and prepare and verify correctly, and then to pre-print it, maybe another hour or two, depending on the extent of the documents that we have. Then again, now the person from manufacturing would have to take that copy and make more copies, and that's another hour or two for them to do that. So what do? They take those copies now and they enter the production suites. And it's not so simple like us walking through the doors, like you and I. They have to go through a whole gowning process, and that gowning process could take 5 to 10 minutes. And then once you're in, then you can have your document. Then once you have your document, you go to different areas and update them. Then you come out again, and you have to take off all those gowns. So that's just for one area. But we have multiple areas in the manufacturing plants. So they have to do this over and over, at least 4 times per person, just to go to different areas to get all those documents updated. So that's just one person for one department. So we have 3 departments, so that's 3 person going to 4 different areas. So great, now they perform all the updates. Now we need 3 more people to go in to verify that they did it correctly. So imagine all that time, that length of time that you have to go through to do this. It's very time-consuming and very laborious. And the other thing is, let's say the person that goes in to verify finds that there's an error. They have to come back out and make the copies, and then gown up again, and go back in, and then gown out again just to come out. So you can see how tedious and time-consuming the process is, and it takes away from the person, the employee, to be able to focus on their main task, which is manufacturing and production. So here, as I was trying to explain, on the first floor, the plant is already split into 2 sections. And all those X's right there basically are the location where the user has to run to update all those menus and forms. Then they will come out and go into the other side of the plant and do the same thing in all those areas. So just on the first floor is mainly cell culture and dispensary. As you can see, cell culture they own about 233 procedures, 68 forms. dispensary owns 179 procedures and 112 forms. And we have to ensure that all these documents are in the effective version in all these locations at all times. That's a lot of paper. So then they also have to go up to the second floor. And again, there's two areas, the purification suites, and this is a small cell banking area. But again, they have to gown in and place documents again in all those different areas. So out here is the office area. This is sort of our master copy of all the documents. And so that's another backup copies that we have as a centralized location. So it's very time consuming, as we can tell. So with the map that you just saw, with cell culture, there's 18 sites for them to go update whenever there's a manual update. For dispensary, there are 13, and for purification, there are 9, and a total of 40 sites. So to do all these 40 sites, whenever there's documents to be updated, it takes 6 people to perform this task. That's on a schedule base. And then there are times where you need documents as an urgent basis, and those are unscheduled. So now when something like that comes about, you need 6 more people to do that again. So that's a lot of effort. So what we decided to do, instead of constantly trying to update paper and always finding that there would be copies missing, there would be some copies not updated correctly, and what would happen is if you find copies not updated correctly, it becomes a deviation. So it's more issues because you can't use procedures that are not effective. So that takes up more time. Now you have to perform investigations and write up reports and assess impacts. So we try first with a bunch of different devices. We tried out the HP Elite Book, and we tried out a C5 tablet. And what the user found is that those tablets, those HP Elite Book and the C5 tablets are a little heavy, and it takes quite a bit of time for the computer to boot up, to log into the network. And so they were asking for something more portable, something that it can just turn it right on and start using it. And so next we thought that the Apple iPad would be pretty user-friendly, because most people are familiar with this technology. And besides, the Apple iPad comes with a lot of accessories where we can buy protective covers. So protective covers are great for the plant because there are areas that that could have some splashes, so it gives you some water resistance to prevent the device from getting damaged. And other things we came up with was that we could find ergonomical charging station that you can charge multiple devices in one area. That way you don't have to have multiple plugs, so it makes it a lot easier again. And with the Apple iPad, it has built-in GPS, so we could control where the iPads are going to be. So we can put them all on the cloud and immediately know if the iPad ever walked away or leave the building, and you could find it. So, I mean, some of you may have heard those stories, right, with the TSA, have you? They went and they pinged the iPad, and it was in this TSA home. But the TSA claimed that they don't have this iPad. Then, there was like, oh, let me show you. Let me ping my Apple, and then it's ringing in the house. So we know, it has a great protective system of its own. Other thing we can do is we can create restrictions, so we can prevent downloads, and we can prevent, other apps from being installed and things like that, just to ensure that they're just using it for viewing procedures and work-related, and no Angry Birds. Yeah, because We try to keep our employees happy. So what did they think? They tried that out, and they thought that the iPad was great. It was easy to use, because it's a technology that everyone's mostly familiar with. So the function was great. It's easy to read. You can kind of tell, how the letters can be zoomed in from large to small. So pretty convenient on the screen. And it really saves time, and that's what it is. It really does save time. So these are some feedback I got from the users directly. And what they told me is, it's so amazing, I don't even need to wear glasses. They can read from the screen because they can zoom in very easily. Others says, no more paper falling off the staple, because some documents are so thick, as you hold them, some of them are falling off. What else they say? No more missing pages. Oh, that's very important. So sometimes they will go through procedures and found out that there's missing pages because someone didn't staple them back properly when it fell off. Then now they have to go reprint a document just to be able to use it. So that takes up more time again. And one of the great things, no more manual updates on the floor. It's mostly great for those 6 people. They don't have to do those gowning over and over again. More workspace, less clutter. Because imagine all that procedures, all that paper that I mentioned that each department owns. That's a lot of documents. Other things we have is the hyperlinks that we created. And you'll see this in the demo, is that with the hyperlinks, it helps the user access their document a lot faster and not have to deal with searching for the document, waiting for the document, or knowing what documents they want to read. So what we do is we create a customized set of hyperlinks for each department based on their work area. And all they have to do is pick the hyperlinks that are based on their location and where they are working, whether it's cell culture, dispensary, or purification. And that list will be readily available to them, and they will just open that document very quickly. And you'll see that shortly in the demonstration. And finally, it is more convenient. I mean, talking from having to go print documents, if there's missing pages and you have to reprint them, now everything is all on the device because you're pulling the documents straight from my QUMAS. So everything is there, everything is effective, it's the right version, you don't have to worry about it. So some of the challenges we faced during the tests, during the pilot is that we have cold rooms and we have ambient rooms. So when they work in the cold rooms and then they come out or go back in, the screen starts to fog up. But what we were able to do is that, just wipe it off with a crew wipes, and that takes care of the issue. So it's really not a big deal, but those are the feedbacks we get from people. Other feedbacks we got is that, they can't really bookmark on an electronic device like you do on paper, just using sticky notes to say, okay, I'm here at this step. So that's something, would be nice to have if we could maybe digitally put a star next to where we're at, where we left off, or something like that in the future. So those are something that we're thinking of, that we'd like to work with our IT partners. Easy to scroll through the document when you don't intend to. So basically, they're saying when the document's on the screen, if you accidentally touch it, it could move to a different page. Well, compared to paper, if you leave it on the table, it's not going to just flip the page for you. So, full screen view without the title. I believe my QUMAS is coming out with a patch for us, and that's going to start resolving those issues very soon. So we're very excited for that one. So doc management system timed out. So if they were trying to view the document using my QUMAS itself, they found out that due to security features, it will time out after like 20 minutes. So we were able to work around that by making sure that when they do, they pull up the most effective version, and then they will go to a full screen view. And in that full screen view, it will not time out. And so they can work throughout the process using that document. So like I mentioned, the difficulty for searching documents led to us to create those hyperlinks. I did a time measurement. So if you were to search the documents manually and punching in all those PRCD numbers and hit the search and then to view and open, I think it takes about 5 minutes to do that. I don't know, maybe our server is a little slower. But with the hyperlinks, because they don't have to figure out what document is already listed there, by touching it, it would just link into my QUMAS, and it could open within 45 seconds. Other concerns we have is the no electronic backup system. And so as you know, in manufacturing, we're 24/7, so we could not afford even a second of downtime without access to our documents and procedures. So with that, right now, we're maintaining one central location of paper manual outside the suites, and that is kind of our primary backup for now. So the implementation plan took a year last year, where we started out at the very beginning of the first quarter or so, piloting those devices, letting people try out, getting all that feedback that I've just mentioned. And so based on those feedback, we know the device will work for us. So we started procuring those devices, configuring all those iPads, and we know there are some people who are not so tech savvy and some that are very tech savvy. So to ensure that we get everyone covered, we created job aid to show them how to use the iPads, how to navigate, and how to go into their procedures. And then we provided training for everybody. And that took quite a while because we have 4 shifts in manufacturing. So 4 groups, four groups. So what they do is they work alternate days. So you have day shifts and night shift. And so we have to make sure we get them all and train them all. So once everyone's trained, we implement the device on the floor, but we still kept the paper there just so that people get sort of familiar with it and try to discourage them to use the paper and try to make sure that they're using the electronic SOP on the iPads. And as they get more and more comfortable, we completely remove all the paper at the end of November. And now, since then, we're completely paperless on the floor. So basically, with that implementation plan, as I mentioned, what we also did was we have iPad ambassadors. And what these iPad ambassadors are peers that are very tech savvy. And so we give them extra training to help people troubleshoot issues using the iPad, such as like, oh, I can't connect to the network. How do I do that? So they can have someone nearby that they can reach out to. Or I do not know how to get to my hyperlinks, or where are those things? So they are able to be right there on the floor supporting all their peers immediately. And that works out really well. And as I said, we have manual index for each department. Yeah. So in the new method, you still see plenty of access, but it's actually more streamlined because these are just locations of where we store the iPads based on the process. But with that, they don't have to run in and out of the suites to update them. All they have to do is go to those stations and grab an iPad, and then they can start working. So same thing on the second floor. These are just the new location where we place the iPads. And then out here is where we consolidate all the menus, the paper menus, as one central backup location. So now it's a lot more easier to manage because you just have one centralized paper copy and not in 4 different locations. So the number of iPads we got, just to give you an idea, on the first floor, on one side we have 18, 7, 14, but basically adds up to 67. It's actually 60 in our plant. The other 7 is the material management, so that's in the warehouse. And they also went fully electronic with 7 devices. So we have a total of 67. So with the new method, it is more compliance, right? Operator always be using the most effective version because they're pulling that document directly from my QUMAS. And they're not pulling from a paper that they hope that someone has updated it correctly. It's a great time saving from what I've described to you about the prepping, the printing, the gowning, the going in, and subsequent verification. So we save about 1,575 hours per year. So that's huge. It pretty much paid for all those iPads already by itself. And the labor cost of saving of $110,000. Yeah. And material costs, not so significant, but at least we make the environment more green. We don't have to worry about toners running out, printers not working, paper jamming, or running out of paper. Less of that issue, because we only have one copy as our master backup. So this is really a huge improvement for us. So with the ongoing enhancement, so we're hoping to test the ability to print from the iPad. So that's kind of something I'm trying to work on this year to see if it's possible, and maybe with some help from QUMAS. And we're also testing our routers and Wi-Fi dead spots just to make sure that everyone has coverage within the whole plant. So we're working with our IT partner on that. The battery issues, so because manufacturing is 24/7, there's a tendency that someone hang on to this iPad and never return it to charge. So now, when the iPad is dead, it's just the same as not having any paper or SOP because you can't turn it on and you can't use it. So we're thinking maybe to buy a couple more iPads as a backup, where the supervisors could hang on to them, have it charged and ready, and in that event, they can just swap out. And so that way, there's always iPads that are charged. So. And we're trying to enhance on the way how the documents are being displayed on the device. So we're working with our IT partner with that. So with that, I would just want to show you the demo. And 1 second to get myself set up here. Mm-hmm. Let me see if I... AirPlay. Am I connected? Yes. Okay. So in the meanwhile, I'd like to thank Matuza for helping to create the sandbox for this demo. He's been very helpful to me.
While you're waiting for them to get booted up, a couple questions.
Sure.
What's been the acceptance rate in manufacturing? They like it? And if I'm doing a Flynn operation, how are you letting them, is it just laying down, or did you put a thing so they can stand it up?
Right. So the acceptance rate was sort of a challenge in the beginning. So there was a lot of resistance to people who are not familiar with technology, who are like the old way of using the paper. But as we roll it out with the hyperlinks and more of the training and the job aid book, a lot of people start finding it useful and start realizing its potential. And from there, we were able to increase the acceptance rate, to a very high percentage. So now everyone's using it, and so we've been getting good feedback now from the user. In terms of, what was the second question?
How do they use it actually in the model or in the room?
Right. So it depends on the area where they're processing. Some people have bought stands or that mount to the desk so that they can clip it on. Some, just like me, would just hold it because they move around from one area to another area. So it's all kind of like their own personal preferences.
And then for the P2P or product-to-product or a batch-to-batch clean operation, do you take the iPads out of the lot area, clean it, and bring them back in?
No, we treat it just like any logbooks. So, and they have protective cases, so they can get wiped out with spore cleanse and alcohol. So the routine maintenance as how they do the batch-to-batch cleaning does not interfere with the device at all. I'm on? Okay, here we are. So this is my device, and typically, you'll go to Safari, and traditional way, where this My QUMAS is designed for the desktop, you would do this login on your screen. So it's going to show up the password. We found out that the the Apple it's a flaw in the Apple Safari. So here we are logging into the system where you normally would do. And so when we first piloted it without the hyperlinks, people had to sort of, manually find the documents they want to read. And what happens is that if you notice that the advanced search and the logout keys kind of close to each other, so people were having trouble trying to get there, and they keep logging themselves out, and they get very, very frustrated. And then they try to zoom in, to get to it. Then what happens is when they zoom in, see the screen get kind of messed up, and people are like, well, no, this is ridiculous. We can't do that. And they just don't know how to get the screen back by just doing a few rotation and things. So what we did was to make it more user-friendly and easy, we bypass all this so that people don't have to deal with the advanced search, the zooming issues or anything like that. So what we did was working with Matuza. He has helped me create some sample documents, which is similar to what I've done in manufacturing, is that we have a list of customized documents in PDF, and it's chronological, so that way they can find the document very easily on what they want to read. And so, like you see, now this is simplified. All you have to do is touch on the hyperlink, like I'm doing now, and then hit open, and it's going to connect me to my QUMAS and pull out the document. And it's not asking me to log in now, it's because I already logged in. So it's going to keep me logged in for the next 20 minutes. So with that, we hit full screen, it pulls up another tab, and you have this PDF document that you can read. And then, let's say they need more documents, they can just close this one because this is going to time out anyway. And they will go back to my bookmark. And let's say open another document. See how fast that is in terms, and it's so much easier. So the user love it because now they're not frustrated. They're not trying to do the advanced search and waiting 5 minutes and, or having to log in 2-3 times before they can do it. All they have to do is just touch this hyperlink, hit full screen, and now you have multiple documents open on the screen on different tabs. And then once again, you can close that. And I'll open one more document. This is our famous paper that Matuza and I co-author. So, look at that. We're famous. So with that, people can browse the document very easily. And the other advantage that you won't have is the ability to zoom in on graphics and tables. A lot of times you have paper copy and you have color graphics, and it's just sort of blurry because it's photocopy. So with this, you can really see your graph and your tables and your drawings so much easier. Other things like you would see here, in let's say documents that have that are very long. Like for example, this one is like 136 pages. So maybe you want to jump to a particular page. With this iPad, you could even try to hit, let's say, page 50. And hit find in this document. So this one's not rendering quite right, but let's say we try something else. Let's try the word. So example. So if you know the keywords or the page number, using the search, it could even jump you there. And then you can see it's showing up at the bottom that there are 32 matches, and you can keep jumping to those sections, which you couldn't do on a paper. So it's really, really cool. This is, makes it so much more user-friendly and a lot easier. Yep. Thank you.